Hey guys, SWEN SANDBERG, physical therapist with YADAYADA. And in this video, I'll be showing you how to do exercises for mechanical low back pain. Specifically exercises for those of you who have a directional preference for flexion. Again, if you are unfamiliar with the terms directional preference or centralization or peripheralization, you're going to want to watch my first video on mechanical low back pain. This video will help you understand and assess low back pain. That video can be seen here, and go ahead and take a minute to link back to that and learn how to assess and understand your pain. In this video, you've decided that you respond best to forward bending activities, and that's why you're here watching this. I must stress that it's very rare that people are flexion responders, that they find that they feel better long-term with bending activities. But there are a few of you out there, and it's important that if you've done the correct assessment and diagnosing from my other video, that maybe you are one of those people. So let's get into it. I'm going to have a quick review here about things that you're going to want to look for. The first thing you're going to want to look for while performing the exercises is, of course, your pain should lessen and it should centralize or stay in your back. The next thing you're looking for is improved range of motion. And of course, your function should improve as you perform the exercises day to day. And the last thing you're looking for is, again, peripheralization or centralization. Again, centralization meaning the symptoms are shrinking, they're staying in your back, or they're disappearing completely. And peripheralization meaning symptoms are spreading out. You may leave your back, down your thigh, and that would definitely be a negative response. Okay, well, let's dive into the exercises now that we've reviewed that, and I have Anna Lee here to help me demonstrate these exercises. All right, guys. Again, thanks, Anna Lee, for being our model today. Anna Lee's going to go ahead with the first exercise. This is called double knee to chest. First of all, what you're going to do is you're going to bring your knees up towards your chest, and then you're going to grab your knees. And go ahead and pull those knees in just a little bit, Anna Lee. Good. And then go ahead and come back to the starting position. You're going to want to repeat this 10 to 15 times. Each time, try pulling the knees in a little bit closer to your chest. Of course, let pain be your guide. The first few may be a little uncomfortable, but then you get better as you go. So watch that. And again, watch for centralization and peripheralization. Again, two important terms here. All right. Thanks, Anna Lee. Let's move into the next exercise. The next one will be sitting here at the edge of the table. Now, these first two exercises, you may find that you can progress to the second one pretty quickly after you've started the first one. And some of you may be stuck on the first one for a few days until your pain calms down. So the exercise is this. You're going to bend forward and reach for the floor. Now, you want to let your back arch and relax, okay? And good. Then take a few deep breaths. Good. And then you'll come back up. And you're going to want to repeat this exercise again between 10 and 15 times for optimal outcome. Again, if your symptoms are moving away from your back or you're noticing your pain intensify, you may want to go back and reassess yourself with the first video, my video on mechanical low back pain, to make sure that you're not actually an extension responder and you've accidentally selected flexion. Okay, come back up. Good. How'd that feel? It was okay. All right, the next one's going to be standing up. And I'm going to have you turn, Anna Lee. And I want you to bend forward and try to touch the floor. Now with this one, Anna Lee, she's going to have a lot of motion here. Not all of you are going to have this much motion, and that's okay. It should improve if this is the correct exercise for you. So go ahead and repeat that again. As you reach down for the floor, you can see Anna Lee has a lot of motion. So we're going to ask her to grab her ankles and pull all the way to end range. Good, and come back up. This is exercise number 3, and it's just a standing forward bend. Okay, so for this last exercise, you're going to need a chair. Now, I have to warn you, with this exercise, not all of you are going to need it, but some of you who only have pain on one side of your back or the other, and not both, this exercise may be very helpful. So the first thing you're going to do is you're going to put your foot up on the chair, and then you're going to go ahead and bend down, reaching for the floor. You'll notice that she's on the inside of her leg, and that's where you want to be. And you go ahead and repeat this again 10 or 15 times, holding it for 2 or 3 seconds each time. All right, good job. All right, guys, so to summarize, when performing these exercises, it should be repeated 6 to 8 times a day. You may not need to do all of these exercises. You may find that you need to do maybe 2 of them to get relief. I would still recommend that you repeat these exercises 10 to 15 times when you do them, and that you hold the position for 2 to 3 seconds. As always, monitor your symptoms. You should notice improvement. If you're not noticing improvement within a day or 2, again, you may have the wrong exercise routine or something else may be going on. Once you've done these exercises for a few months and your symptoms hopefully have improved and disappeared, you're going to want to keep up with some of these exercises a couple times a day. So you may opt to do the lying down or the first exercise where you bring your knees up to your chest in the morning and in the evening to maintain improvement. You're also going to want to continue to watch your postures. If you're noticing a position that's increasing your pain, then you're going to want to avoid that position and opt for a better posture. And then, of course, the last thing you're going to want to do is interrupt your positions frequently. I think moving around is going to be your best friend in this case. So again, if you are a flexion responder, so you have a directional preference for flexion, these exercises should help you. If you are not noticing lessening pain, pain that is centralizing or symptoms that are centralizing to your back and then disappearing, or if you're noticing a decreased range of motion or decreased function, then you're going to want to seek out a different treatment option and obviously talk to a qualified healthcare provider. All right, well, good luck.